they also think like OCD is only seen in adults. No, it can be seen in even children. Let us also understand about panic attacks and panic disorder. So panic attack is a sudden onset of intense fear. So on the outset, any other person cannot identify if this person is actually going through any kind of anxiety. They go to the emergency department, they run from one emergency department to another, they run from one cardiologist to another, they get various investigations done. So I have a patient who has obsessive doubt about locking the door. In the night times, whenever she goes to sleep, she has to repeatedly again go back and check. They want somebody to do some magic, like I'm attending the therapy session. So after this, after few sessions, my obsessions are gone, my compulsions are gone.
Greetings, welcome back to the Mind Reimagined. I'm Ellen Chamberlain, and welcome to this podcast about mental health and paths to wellness. It is my pleasure to introduce Dr. Kruthika. She is a consultant psychiatrist and neuropsychiatrist at Maarga Mind Care. Dr. Kruthika completed her MBBS in Karnataka and her MD in psychiatry at the Rajiv Gandhi Institute of Medical Sciences. Over the past several years, she has worked both in government and private hospitals, helping people navigate a wide range of circumstances in regard to their mental health. Everything from depression and anxiety to OCD, bipolar disorder, and de-addiction. She practices very patient-centered care, creating individualized treatment plans, and works with individuals, couples, and families to blend therapy, counseling, and medication management, bringing about a successful outcome for the family as a whole. She is the perfect guest for the Mind Reimagined, since she is known for her commitment to reducing the stigma associated with mental health challenges by actively spreading awareness. Welcome to the discussion. We'll be talking about anxiety and OCD. Hi, how are you?
I'm fine, Ellen.
Thanks for being here today.
Thank you for having me on today. And I'm excited to talk about the topic which is close to my heart, which many people are suffering from, but it is not enough spoken about.
I completely agree. Can you tell me what inspired you to become a psychiatrist?
So when someone asks me what inspired me to be a psychiatrist, I go back to my MBBS days, where I came across some of the patients who are suffering from various psychiatric illnesses, where initially I did not grasp the depth of what they are suffering from as anybody else. But after finishing my MBBS, I again joined as a junior resident in the Department of Psychiatry, even before joining my MD Psychiatry training. So during that time, I could see there were many patients who were suffering from psychiatric illnesses. There was a lot of suffering which was being seen. There was a lot of burden on the families. And it is also how differently the psychiatric illnesses were seen when compared to the physical illnesses. The psychiatric illnesses were being labeled, judged, and in that way it was handled. But a family or somebody going through a physical illness is easily they are shown empathy, they are shown support, and people come to see them. But that doesn't happen with a psychiatric illness, and there is so much of burden on the family. And there is a lot of lack of resources, but the demand is huge. All of it made me think, why should I not go into psychiatry and try to make some difference which is possible by me?
That's fantastic.
So I choose psychiatry.
I love that. You've worked in both government and private hospitals. What did those experiences teach you about mental health in India, as you were just sharing that stigma, I think, is what you're referring to?
Exactly. So, having worked in both government and private institutes, in government institutes, what I see is the demand is very huge. There is a requirement of mental health services, but the limited resources are available. But in a private setup, the resources are good enough. We can provide patient-centered approach. We can provide multidisciplinary approach. We can provide regular follow-ups and other things, which is very difficult in a government setup. And stigma still plays part in both the places. Even in private setups, people do not come forward to seek help immediately. They wait. Only when the symptoms become very severe, they start seeking help because of the stigma again.
Why are conversations like this in community spaces? This podcast is for the community. Why is this so important?
So, this kind of conversations are really very important when you want to break the silence, when you want to reduce the stigma associated with it, when you want to make people more and more aware about the conditions which the people can go through. And it also instills hope in the families and also the patients who come experience these kind of symptoms, that there is some hope, help available where we can reach out to, and we are not alone who are suffering from this kind of hope, and reducing the stigma and increasing the awareness. So this kind of conversations will definitely help in those things.
Yeah, no keeping secrets. How do you explain anxiety to someone who thinks it's just worrying too much?
See, anxiety can be a normal emotion which anybody can feel, where our body and mind and brain is preparing us to face the threat which comes across a person. So there is the frontal cortex, the prefrontal cortex sends signals to the amygdala. Amygdala sends signals to other parts of the brain, and there is sympathetic activation which happens, sympathetic nervous system activation, and the body and the brain and the mind is prepared to face that threat. And this anxiety is normal. But when we consider it to be an anxiety disorder, it is something just not worrying, where we have both psychological symptoms as well as physical symptoms. So in psychological symptoms, yes, there can be worrying, but it is associated with other kinds of symptoms as well.
So, an athlete experiences anxiety before a match, and I've read that that is necessary and a part of the pace of that process, and not just heightening the senses, but the fear, the excitement. But you're saying that a person with anxiety in the day-to-day, what physical symptoms will I see?
Huh.
How can I know? What can
Okay.
I look for in myself?
Okay. So first of all, whenever, as I told, a person faces any kind of stress, a healthy anxiety or a healthy amount of anxiety is okay to face. Like, it makes him more alert. He becomes more vigilant. Otherwise he can be very careless or not doing. When there is a deadline there, then you become more careful about your timing. You become more alert, and your focus is more increased, and you manage your time and try to finish off that deadline. So that is how we face the stress with the help of good amount of anxiety. But if this becomes more persistent, if the intensity is very high, and if it is constantly present for a long duration of time, and it is in making you incapable, or it is not helping you to be more productive, it is making you lose the focus, and your focus is lost, and because you're not able to focus better, you're not able to complete your task at all. And in healthy anxiety, there is a threat, there is a stress, and a proportionate amount of anxiety is there.
Right.
But in a case of anxiety disorder, there may not be any threat, or the threat,
And it's always there.
correct, but the perception of the threat is always there, and the amount of anxiety created is very high.
So I'm happy we're having this conversation, because if I'm correct, the diagnosis is becoming more prevalent now. As medicine learns more,
Correct.
then more people are being identified with GAD,
Exactly.
like this generalized anxiety disorder.
Huh.
So I think I am not. I'm an anxious person, like you said, around tasks.
Correct.
Yeah.
But
And that's
it helps you
natural.
deal with the task.
Right, right. That's
Correct.
natural.
But when it is becoming disproportionate to that, then it is called as an anxiety disorder. When it is proportionate and it is helping you to do the task, it is good enough. And when you ask me about the symptoms and both physical symptoms also, when I told, let us understand more about different kinds of anxiety. Like there is generalized anxiety disorder, there is panic disorder, there is social phobia, there is specific phobia, and many more. So, what is generalized anxiety disorder? So, when we consider generalized anxiety disorder, the person is apprehensive, they're too much of worry about the day to day tasks, like even taking care of family, day to day activities, daily chores, office, work, family, health, children, anything in a day can make them anxious and worried. The again the worry is too irrational, so that is where it makes difference. Okay, the irrational fear about the day to day things is called as generalized anxiety disorder. And the it is also associated with other physical symptoms, like they feel exhausted, they feel always on the edge, they feel restless, they feel tired, they are feeling fatigued, they are not able to focus on anything, they feel more irritable, they are not able to relax themselves, they are not able to sleep, and that is when we call it as generalized anxiety disorder.
It seems like a lot of those symptoms that you're mentioning could easily be diagnosed as something else, because tired and short-tempered, we might think that is any number of things.
But for us, we have diagnostic criteria which we follow, and this consistent symptoms which I told should be present on an everyday basis for almost 6 months, and then we call it as a generalized anxiety disorder. Just for a few days, if somebody is experiencing due to stress, again it is not a generalized anxiety disorder. It is persistent for every day and almost for 6 months. Then we call it as a generalized anxiety disorder. So let us also understand about panic attacks and panic disorder. So, panic attack is a sudden onset of intense fear. Within minutes, it starts, and it's so overwhelming. And person also experiences a lot of choking sensations, different difficulty in breathing, chest pain, dizziness, sweating, trembling within minutes, lasting for 10 minutes, 20 minutes, or 30 minutes, kind of a thing. And person may also start feeling an impending doom, that as if something is going to happen to me now, I'm going to die now, I'm having a heart attack. This is called as a panic attack. And this panic attack can happen in various mental health disorders. But if it is happening out of the blue, once it happens, it repeats again and again, there is a third episode, fourth episode, then it creates something called as anticipatory anxiety. When am I going to have next attack again? What will happen if I am having this attack again? Where will I be when I'm having this kind of an attack? Will I get any help when I'm having this attack? If I'm in a crowded place, who will help me? If I'm in a heightened place, will I get any help? Or if I'm alone at home, will I get any help? Or if I'm experiencing this attack now in the night time, suddenly they may have this attack and they wake up and they are having this kind of a pain, and they should rush to the emergency department thinking that they're having kind of a heart attack, and they get assessed so much like multiple ECGs, blood investigations, 2D echoes, and other investigations they do get repeatedly done. And this anticipatory anxiety and having this attack repeatedly is called as panic disorder. So next, when we come to another anxiety disorder, it is more of social phobia. Social phobia is something where a person is feeling anxious in social situation, and he has fear of being judged or scrutinized by others.
Don't we all have that? I'm having it right now.
No, it is because of which the person shows lot of blushing or kind of sweating, trembling, dryness of mouth, and there is blanking of mind because of he fears that he is being judged. So there is blanking of mind, and he cannot talk more, or he cannot tell anything more about it. So because of which he starts avoiding, freezed. So he starts avoiding any kind of social situations, meetings in the office, meeting any social gatherings, and all of that. That is called a social phobia.
Are there cultural or social factors in India specifically that make it harder for people to seek help for anxiety?
Definitely. In India, there is again a lot of stigma, because of which they do not come forward to seek help immediately. Only when the symptoms become very severe, they come forward to seek any kind of help. And they think what others will think if I go to a psychiatrist, or will they judge me? Will they think I'm a weak person?
More anxiety.
Yeah.
It causes anxiety to think about it.
Correct. So in that way, they avoid coming to doctors. And also there can be kind of in families, they see that if a daughter is going through some kind of anxiety and she wants to seek some help, some parents, not everybody, as of now we see that some change is there in this concept, but still some parents feel that if she's going to a psychiatrist, will she find any prospects for her marriage? So these kind of thoughts in parents can withhold the girl from going to any psychiatrist in spite of experiencing anxiety symptoms. And another thing which I notice is lack of awareness. So even now I see that many people who are having this kind of panic attacks which I described, that suddenly when they're having that kind of a panic attack, they have the chest pain, so they feel that they are experiencing some kind of a physical symptom. Okay, they feel that they're having a heart attack and they go to a cardiologist, they go to the emergency department, they run from one emergency department to another, they run from one cardiologist to another, they get various investigations done, and there is no awareness. Okay, once twice you're experiencing that, you're getting assessed, okay fine, it is not an heart attack, you know that, but still because of lack of awareness they continue doing that. They do not come to a psychiatrist seeking help for panic disorder.
Well, that sounds like also a lack of awareness within the medical
Is
community.
exactly, the emergency department people are not trained enough to identify the panic attack. And gender roles definitely play part in India. Like when a woman says that she's going through some kind of anxiety, she's being told you're just overreacting. It is just hormonal.
Yes.
And if a man says, I'm having some kind of anxiety, you're a strong person, you are a man, how can you have anxiety? What are you talking? This shuts them off. They cannot
Right.
come forward to take any kind of help. So these are the social and cultural factors which definitely affect them from seeking any kind of help.
It sounds like it can be very difficult for a person to even name anxiety as what they're
Exactly.
experiencing because you're naming all these symptoms. Oh, I'm having headaches, stomach aches. I think sometimes the internal dialogue from a young age or the feeling of anxiety from a young age, it's so folded into your normal operating system that you don't recognize
Exactly.
anxiety, but all you're aware of is the symptoms.
Exactly.
Yeah,
And
that's
they,
rough.
with those symptoms, they go to physicians and they go to general doctors. They don't think that it is part of anxiety.
Yeah, because that dialogue is what it's always been. So, how
Exactly.
do you know it's a problem? Let's talk about OCD. That's a term people throw around casually. I'm so OCD about cleaning. But what does OCD really mean?
So OCD is just not about cleaning. OCD is beyond that. OCD is a chronic neuropsychiatric condition with waxing and a waning course, which consists of both obsessions and compulsions, or sometimes predominant obsessions and compulsions. So, what are these obsessions? Obsessions are unwanted, repetitive, intrusive thoughts, images, or impulses which creates a lot of distress and anxiety in a person, and then this anxiety leads them to do some kind of compulsive behaviors to overcome this anxiety, and this vicious cycle of, once they do the compulsion, again the obsession is back, and then again there is anxiety, again there is a compulsion. So this vicious cycle of obsessions, anxiety and compulsion is called as more of OCD, and just not the cleaning. Oh, I'm so worried about cleaning. So that is not OCD. It is the vicious cycle which they get trapped into is called as OCD.
Can you share maybe a case that you have assisted where a person had OCD, something not like cleaning, but maybe something else that you see somewhat commonly?
We see different kinds of OCD symptoms. Okay. So OCD here we see like there can be obsessions. Obsessions can be of different types. Okay. So obsessions can be of one. The first obsession can be like obsession of contamination, fear of contamination. There is dirt everywhere. There is the things are not clean. There is pollutants everywhere. There is kind of
Bacteria. I'm a bacteria girl. Yeah.
bacteria, germs around all the everywhere. So I need to keep cleaning. That creates an anxiety, and that leads to compulsion of cleaning. But that is not the only kind of obsession which we see. There are other obsessions also. There are other obsessions, like there can be obsessive fear, obsessive doubts, like where they have doubts if they have switched off the things properly or not, switched off the stove properly or not, if they have locked their house properly or not. They repeatedly check. So there is an obsessive doubt and there is a repeated checking behavior. So there can be other kind of obsessions like aggressive obsessions, wherein they have aggressive thoughts or thoughts of harming their own family members, or some for a mother, she can repeatedly have a thought that she may harm the child. She may have, if whenever she is looking at the knife or any sharp objects, if she feels that she may harm the child. That is again an obsessive thought. And then there can be sexual thoughts or blasphemy thoughts. These are called kind of forbidden thoughts which are bothering the person, like kind of obsessive sexual thoughts, where they're getting thoughts or images of sexual images, which creates a lot of guilt and anxiety in a person. And there can be kind of blasphemous thoughts, where we see that the person can have thoughts of sexual thoughts, or the thoughts of scolding whenever they are seeing a god's image, or praying. While praying, they can have this kind of thoughts. So these different kinds of obsessions and compulsions can be seen, and just not about cleaning. And one more thing which I can say here is, even as people think that it is only OCD is just about cleaning and cleaning, or washing and all of that. They don't understand other things are also there in the OCD. So even the person who comes to us tells about different symptoms which they are going through, and when we say this could be a kind of OCD, let us assess further. Oh, is it OCD? I am not doing any cleaning behavior. I am not washing my hands multiple times. So how can this be OCD? So that amount, so people don't know about other kinds of obsessions and compulsions which can also be there in OCD.
Such as
I told, the blasphemous thoughts, the sexual thoughts, the
what
doubts.
is the compulsion that follows that obsession?
Yeah, that kind of thoughts, whenever they can have that kind of thoughts, they can create some kind of mental rituals. That is also kind of a compulsion. They should,
Counting.
correct, counting, or they should count particular number of times, then this thought goes away, they think. Or if they're having that kind of a thought about God, then they have to pray this number of times. If they pray these many number of times, then this thought goes away, is what they feel. And this cycle continues.
Sort of setting up a magical thinking to take care of the obsession.
Correct.
How does OCD typically show up in someone's life? Are there patterns that you can notice before it's really serious?
Okay. Now, so here I would like to talk something about ego dystonicity.
Can you say that again?
Ego dystonicity. Ego dystonicity.
Okay.
There is the obsessive thought which comes here in OCD is completely against the values of the person, against the beliefs of the person. Okay. So somebody who is more religious, somebody who is more spiritual starts getting the blasphemous thoughts. A mother who is so caring, so loving towards her child starts getting intrusive thoughts about harming the child, or some other unusual thoughts about the child. So that ego dystonicity creates a lot of guilt in them. And this ego a lot of guilt. And how can I think about it? How can this kind of a thought come to me? How can I think like this about my own child? And that repeats the cycle. This anxiety creates about that particular thought, and there is a lot of anxiety that how can I be having this kind of thought, and the thought repeats. Okay, that is how the thought continues.
I have never heard that piece before about obsessive compulsive disorder, that it is often something that opposes your natural personality. Correct. That's very, very interesting.
And there can also be kind of reassurance seeking behavior in OCD, like for checking behaviors, for example. So I have a patient who has obsession of obsessive doubt about locking the door. In the night times, whenever she goes to sleep, she has to repeatedly again go back and check, if did I lock the door or not. So she started asking her mother, Ma, did I lock the door? Did I lock the door? And then once she gives the reassurance, yes, it is locked, don't worry. But again, it doesn't satisfy. Again, she has to ask. Again, she has to answer. This reassurance itself becomes a compulsive behavior. It itself becomes a part of our OCD. Okay. So these kind of behaviors are seen in the families. So this has to be kind of addressed when we are treating OCD.
So that example of checking and how that just becomes integrated into another compulsion, just another piece of what you need to feel comfort, to feel normal. Um, that makes sense. That is very clearly, that would be an alarm bell for me. I would understand in my partner that that's not normal.
Correct.
But the other ones you were talking about sound, I mean, how could I know, or how could my partner know that that's OCD? When we make accommodations for each other, we're doing it because we live in the same house and we think it's our personality. Like, oh, she takes forever to do the dishes, I'll just do it myself. We just think that's personality, that's behavior. So it seems like it's something that's so easy
And
to
that's
miss.
correct. And that's the reason it takes a long time for the, and they are continuing with their life. The person is accommodating and the other person is suffering from this continuously, and it takes a
We
long
think
time
it's
of time. Then
cooperation.
they, yes, and then after a long time that they come to seek help, they know that something is going wrong. They know that she is taking longer than required, but they are just adjusting with it. And only after a long time they come for help.
OCD seems so overwhelming, so hard to identify. What are some of the most common myths or misunderstandings about OCD?
So, as you asked in the initial question, also, like, is it just about washing and cleaning? So, it is not just about washing and cleaning, it is the vicious cycle. That is one of the myths. Like, somebody is being more particular about the things being very clean and all of that, they consider that to be OCD. So, that is a myth, that is not OCD. And somebody who is more organized, somebody who just double checks on things, wants things to be in place all the time, they consider that to be OCD. Again, that is not OCD. So the things like somebody can consider like when they are doing the cleaning compulsion, they feel that they are doing they're enjoying doing that, and that's the reason they are doing it. But actually speaking, it is not. They know, the person who is going through OCD knows that it is senseless, it is absurd, it is senseless to do this multiple times, but still they can't control doing it. They have to do it in a particular way, they have to do it particular number of times, they have to do it in a particular ritualistic way. Only then they feel satisfied, because that is part of a disease. But others think that they're enjoying doing it. And they also consider, whenever there is a family member going through this kind of OCD, they tell that you can control it by your willpower. Why don't
Right.
you do that? So it is not possible, it is definitely difficult, and they need help there. So these kind of mind, they also think like OCD is only seen in adults. No, it can be seen in even children. So these are some of the myths and which we come across in OCD.
Can anxiety and OCD be cured, or is it more about learning to manage them?
So this the answer for this question depends on various factors. The prognosis. I mainly can consider it as prognosis. How the improvement will be for that particular person depends on various factors. It's like how early the onset of this kind of illness was, how severe the symptoms are, and is there again associated with other comorbidities, and based on various factors, and if there are any other personality disorders also associated with it. So based on various factors, the prognosis depends. But most on a high number of patients definitely improve with medications, treatment, and therapy, and all of that. But some people may have to be on the treatment for some longer time.
Can you share an example of a success story, something that gave you hope, where someone really turned things around?
Hmm. Definitely, I see a lot of patients who start showing some improvements and are also doing very well, and that itself gives us hope to treat further patients. So I have a girl who is kind of had some amount of OCD symptoms in childhood, but she came to me when she was giving her 12th exams. The symptoms were very severe that time, and we started her on treatment, and now she's in her second year of degree, and she's doing very well. She's able to cope with the stressor. She's able to do well in the OCD part. The girl, like as I was telling, that kind of lot of reassurance seeking behavior was there, and lot of obsessive doubts and obsessive compulsion, obsessions of cleaning, contamination, and all of that was there. But she's doing very well. She's not having very minimal or even nil obsessive symptoms now, and she is doing very well in her studies as well. And anxiety and panic disorder, though, there are n number of patients whom I'm seeing where the improvement is very good, and and some of them we have already come off the treatment and they're doing very well in their job.
For someone listening today who thinks this might be me, what's the very first step they can and should take?
Yes. So anybody who thinks that they are going through any kind of these symptoms, please go and meet nearby psychiatrist or a psychologist. Talk about your symptoms. See if there is any help required there, instead of worrying about what others would think about if you go to a psychiatrist.
Is there any one thing you might like to share with the public in general about seeking mental health? Not necessarily anxiety and OCD, but...
So when we say this, I can give priority to your mental health as much of priority that you give to your physical health. You want your blood sugars to be under control. You keep checking them. You want your blood pressure to be under control. You keep checking them. You go and visit your doctors whenever there is any kind of physical discomfort that you're feeling. So similar way, when you have any kind of mental health symptoms, any kind of difficulties in your mental health, go seek some help immediately. Do not wait for the symptoms to get worsened.
Mental health is health. Thanks a lot for joining us.
Thank you for having me.
That was an enlightening conversation. I learned a lot. I hope you did too, and I hope you'll join us again. I'm Ellen Chamberlain. This is The Mind Reimagined and Paths to Wellness.
You've been listening to The Mind Reimagined, Paths to Wellness. Continue to tune in and heal within. See you on the path.